Well, good morning, everybody, and welcome to the fifth meeting of the Medicaid Client Voice Council, the last in our current setup, because in January, we're not only going to add new members, but we're going to be meeting in a new location. We'll be meeting right down in this building next to the building we're in. So if I don't remember at the end of the meeting to remind you, I wanted to make sure I had it at the beginning of this meeting. So you'll get an email reminder and text reminders about that. But we will have a new location, and we'll welcome 8 new members to the council next week or next year. Unfortunately, because of the change in date and some things have come up in some of our members, we have a smaller meeting than we are still expecting Michelle, and I'm hoping that Deandra and Laura join us as well. But we do have a smaller meeting today due to conflicts, illness, and other things. But before we get started, we also have something else that's new. We have a new secretary of the Department of Human Services. This is Mark White's, not his first meeting. He's been here, I think, at all of our meetings, but it is his first meeting as the secretary of DHS. So I'd like to welcome him to the podium. He has a few remarks he would like to share with you.
Thank you, Jason, and thank you, everyone. I'm just very happy to be here with you today. I'll tell you, of all the things that Secretary Gillespie did in her tenure here, one of the most exciting things was creating this council, because I know we've always had a need to hear from our clients so that as we make decisions and not make our decisions in isolation. And so that's why I'm so grateful for you and the time that you've committed to be part of the council, to come back, to hear from us, but also provide us feedback, to give us your perspective and help us understand the realities of the policies that we implement and the decisions that we make. Because that, I know that's too often that's been a missing piece, and so we're so glad that you can help us fill in that gap and do that. So I don't have a lot to say. I was going to bring a 2-hour speech, but I was persuaded not to. So I'm going to let the experts who know what they're talking about talk with you and listen just as you listen. But I just wanted to say thank you. Appreciate you so much. I do, and Bradley and I were talking just a little bit earlier. I will just let you know, of course, as we know, we have a new governor coming in. She will be sworn in on January 10th. We've already been having conversations with the new governor's team to talk through DHS, through the issues that we have. We will see what direction the new governor wants to go. At this point, I don't have any indication of the new governor wanting to make any major changes around DHS or Medicaid. That's been an issue she's talked some about, but her focus really has been more on education, on crime and prisons, and that's where she's focused most of her attention. Everything I'm hearing right now is that I think the new governor will want to take a very deliberate approach to DHS and Medicaid, to come in, to listen, to see what's going on, and then to think through and talk through if there are any changes that she wants to make as she puts her imprint on the state's future. But that's we'll see what she finally decides as she comes in and is sworn into office. But with that said, thank you again for being here. So excited to hear from you all today, and I'll turn it back over to Jason and the team. Thank you.
Thank you, Mark. Also, for those of you watching online, for the first time, we have enabled the chat feature online. So some of our members, Nathan in particular, was really excited to be here today. He had a transportation issue. He's going to be watching online, and if he has any comments or questions about the things we're discussing, he and the other members who are watching online can add their comments, and they also have my cell phone number so they can text me if they have comments as well. So Jerry Watson is going to be our chairperson in 2023. Allison can't be here today, so Jerry is going to be acting chairperson today. And Jerry, if you have any opening comments, or you can welcome up our first guests.
Good morning, everyone. Thank you for making it out in spite of the stormy potentials that we are standing under. Can everyone hear me?
Yeah, that's only for online. If the microphone's on, it's just for our online audience.
Okay, and my name is Reverend Jerry Watson, first giving under the God. Hope we have a blessed meeting and become very informative and help to everyone in the state who's receiving Medicaid benefits, improve their services, and for that, I'll just make one comment. I've been doing some research recently on diabetes mortality rates in the United States. And Arkansas has one of the worst diabetes mortality rates. we're not as bad as West Virginia and Mississippi, but with number 3, you know. And a couple of border states, Louisiana and Oklahoma, are right behind us. So there's something in the water in this area. I did some further analysis on Arkansas, which shows that most of the poor counties will have lower income per capita rates, which get a lot of services from DHS, have much higher mortality rates than some of the higher income counties per capita income. And so maybe in the future, next year, we could take a look at some of that and see how we can make some improvements and get out of the bottom and move up to with some of the other states. Okay?
All right, thank you, Jerry. So the public health emergency unwinding, we have some news on that today. We also shared with you as a council our internal plan, how to educate the public and especially Medicaid recipients about the public health emergency unwinding and what it could mean to them. So our first guests are going to give you guys an update. They have a PowerPoint presentation, want to let you know where we stand and where we're going as an agency. So let me welcome to the podium DHS Deputy Director of State Health and Medicaid, Dawn Staley, along with Interim Chief of Staff and the Director of the Medicaid Control Center, Amy Webb, and they can provide you all with that update.
Dawn and I are both short, so I'll move this down.
Thank you, Amy. I'm just going to do that myself. So, well, welcome. We are super excited to have you all here, as well as folks who are online today. As Jason said, we do have a PowerPoint, but we were not planning to go through it because we know that we come to these meetings and oftentimes we have a lot of PowerPoints. And so we would rather, you know, if it works for y'all, I think just have a discussion. Hopefully folks have had a chance to read through the draft plan. And certainly we have the slides. We can go through them. We can also just use them for reference. But we really just hope to have a discussion today and talk a little bit about your feedback, questions that you may have, also to provide some updates on what we know is today. I think as folks may have seen, we did not end up getting the 60-day advance notification that has been promised to states before the public health emergency ends. And so because of that, we are expecting that it will continue for like another 90 days past January. So somewhere next spring is kind of what we're anticipating based on the latest guidance. But that said, we still know there's a lot of work to be done. We have continued to meet with different stakeholder groups, continue to try to look at how we can get information out, get people to update their information. I know several of you have been a big part of that, and I know we've got a little video later, I think, to show some of the great work that y'all have been doing to help with that. But like I said, we can definitely walk through the slides, but we also hope just to be able to have a discussion today. So, Amy, anything you want to add?
No, I think that's it. I think if we do get the 60-day notice for April, we should get it February the 11th. So we will keep you guys posted and updated on when and if that happens. It's going to happen eventually, so. But we'd really just love to hear from you guys. What were your questions based on the plan? What feedback do you have, or do you have any suggestions on things we should do that we didn't think about?
I read through everything, and I really do feel like that you guys are doing everything that you can to reach the community. In the profession that I am in, I do see clients on a daily basis most of the time, and one of their fears is losing their health insurance. But I did want to say I really liked how that you guys had placed in there that if, say, for instance, no longer they don't qualify for Medicaid or AR home, you guys are going to help transition them hopefully to the marketplace to where they can at least continue some type of health insurance. Because like some people that I've spoken to, like family members have developed cancer. Some of these people are in cancer scares themselves. You know, they're just holding their breath on when is this insurance going to end? Am I going to make it till the insurance ends? There's just been a lot of things that I've seen. And I think that's one battle you guys may want to advertise is that, hey, keep in mind that if you no longer qualify for your health insurance, you're not just gonna have anything. We're gonna try to assist you in helping you to attain something. Because I'm telling you, I hear that all the time. People are afraid of losing their health insurance.
That's really helpful. And yes, I think anything we can do to help get the message out, because we actually had a call, I guess it was yesterday,
Yeah.
with the federal marketplace folks in DC, just to talk a little bit more around what we're doing, how they could help us if there's things that we haven't thought of. You know, and the good news is, you know, we actually, we're sending data to them, and they confirm that, yes, they are getting our data. So when somebody is determined that they're not eligible for Medicaid, that information gets sent to the marketplace, and then they can go ahead and reach out and say, hey, just want to make sure you know that there is this other coverage available. One of the things that we realize, though, is that if we don't hear from somebody, which unfortunately is most of the reasons why people end up losing coverage, is because we don't hear from them, that information doesn't get sent because we don't know whether or not Amy was actually ineligible, or if she just didn't get it, or if she just didn't want to respond, or, you know, any number of reasons. So I think, to me, that really kind of reinforced the need to say, hey, even if you think you're not eligible, or if you know you're not eligible, right? I mean, please, you know, update your information, send that back to us, because then we can help. We can help with that transition, whether it's marketplace coverage or whatever it is. So to me, that was a key takeaway from that call yesterday. I think the other thing that we're trying to do, and we've been working with the qualified health plans for some time on this, is to really focus on that outreach, because they know, based on the information that we have, that we've been able to say to them, hey, we tried to redetermine Amy's eligibility, we couldn't do it, so she's at risk, right? She's one of those folks that that based on the information we have, she is likely to lose coverage unless we can get some additional information and determine her eligibility. So we're really trying to get everyone to be able to focus on that and say, hey, just reach out, update your information, even if you think you're no longer eligible.
Yeah, and the marketplace folks did say they're going to take what we send them and they're going to do targeted outreach to the individuals who lost coverage. So they'll first try through the mail, but they will use other avenues if they can.
Well, a lot of people don't realize that, you know, say for instance, if you get health care through the marketplace, there's reconciliation on the tax return. And a lot of people don't realize, say, if halfway through the year their income decreases, in reality, you know, that can affect, like if they have had to pay premiums, they can get a refund of those premiums. The unfortunate side, though, is if their income does increase, then they have to pay in some of those premiums back. But at the end of the day, people just really need to be made aware of, okay, so you've had Arkansas Home or you've had Medicaid for this time. Don't be fearful to reach out, because, you know, it's not our goal to terminate your health care. It's our terminate to place you on the best plan that suits your income.
Right.
Reba, we have a phased approach for educating the public about this, and Reba kind of skipped to the last phase. Do you want to educate the members about the different phases that we've gone through?
Yeah, I can tell a little bit about that, and I may steal Mary's talking point. But so right now we're in the initial phase of Update Arkansas, and really what we want people to do is update their address. And so we contracted with AFMC to do a hotline where people could just call and update their address. They don't have to go online. They don't have to go into the county office or anything like that. They can just call and update their address. And at the same time, AFMC is doing outbound calls to all those people that we know are at risk of losing their coverage because it's been extended. And Mary, I don't know what the numbers are today, but last I heard,
It's over 100,000.
Yeah, either we have confirmed addresses or updated addresses for like 110,000?
Over 120 the last time.
Oh, 120,000 people. So that actually makes us feel pretty good, but that's still only about a third of the total population that's extended. So more work to do on that, but they're continuing to make those calls. And then the communications team, and you guys, they'll talk more about it, but when it gets close to the time where it's time to start sending out renewals, we'll switch that message from Update Arkansas to Renew Arkansas, to just tell people, all we want you to do is respond to your renewal if you get it. Just respond to your renewal. That's the message at the end of the day, because that'll be how they keep their coverage or transition their information to the marketplace.
So I receive letters every month. So I've renewed, I've updated my address. They have all of our income and everything. So we we have renewed. But why am I getting letters every month when that money could be spent towards something else?
That is a good question. I mean, renewal is not the only time we would send letters. We would send letters if changes have been reported or if any of our data source matches brought information to our attention that we needed to ask a question about. There are several reasons, and probably would be better for me to talk with you offline specifically to see exactly what might generate your letters. And of course, some people have Medicaid and SNAP or T or other program, and so it could be something in that other program that has caused us to need to send a letter out. But to answer your question specifically, I would talk with you offline and we'll get to the bottom of it.
Hey, so I have a few questions. Will the QHPs be able to use the contact information that they have on file to provide it to DHS, or is there like a streamlined way?
Oh, I've got it. It's okay. Thank you, Mary. Yes, that's excellent questions. That's one of the things that we have been working with our federal partners to be able to look at information, whether it's the qualified health plans, the passes, or others that may have on their files that may, be different from our information, and for them to be able to actually send us that information, and then we can update it. So we've started that process now. Mary has a team that's been working on beginning the process to get to start getting that address information, and then having our team go ahead and confirm that, to call and say, okay, Amy, are you at this address or are you at this address? That way we can go ahead and update that information. But yes, because we know that, whether it's because of multiple notices or whatever reason it may be, that the pharmacist has a better address on file than we do. So we're trying to do whatever we can to get that updated address, whether you've given it to us or you've given it to your plan or to whomever. So hopefully we can have the best address on file.
And we did get approval from the feds to accept some addresses without the need for additional verification. So, for example, like the passes, well, they have to see people every month, right? And so they're gonna have the most up-to-date address. So we can ingest those pass addresses without the need for additional verification, so long as the client verified it with the passes initially. And we'll also be able to get data from the, what's it called?
Postal
Return
Service,
mail.
oh, return mail, yes, from that, yep.
The National Change of Address.
Yep.
I was like, what is it called? National Change of Address Database. We'll be able to get that as well and use it without having to do additional verification.
Okay, and then I have two more. I know that you guys recently advertised a small grant funding. So do you know how many organizations have taken advantage of that application process?
Jason, do you know?
I think we've only had 2 or 3 applications come in
Okay.
so far.
Okay.
Tabitha sent me a couple this morning,
Okay,
so not many.
okay,
But because the public health emergency's been extended, we're not really pushing as hard as we would. had we-
understandable.
Yeah.
Because we don't want them to use the money before we ever even get to
To the part where it's like really
Yeah.
detrimental to
Yeah.
get the word out. Okay, and then the last question is, okay, with Act 780, and, if they do have to complete the redeterminations in 6 months, that's going to be ongoing, going forward. It's going to be like a public health emergency every year, because, that's the reality. At least when we talk to our national partners, that's what they said. So has there been a lot of influence from DHS to the legislature, or will there be, to say, hey, considering the workforce issues we have in DHS with people processing applications and having to hire on contractors and not wanting this to be, that's not sustainable for DHS. So will there be a lot of influence on them to, hey, is there any way, I know that there was risk of like fraud or people taking advantage of the program, but sustainably for DHS, it's best to do it in a year process if that's what the federal government's allowing? Or do you foresee that being a conversation?
So we have been, much like with this group and others, we have been talking with folks around, what the numbers look like in terms of, that close to 400,000, and then how that breaks out, right? Because that 400,000 is one part of, the approximately 1.2 million people that are overall enrolled in Medicaid. And so I think just to clarifying that point, the 6 months of Act 780 applies to like those 400,000. So
Okay.
everyone else, right, so the rest of that 1.2 will go through normally, right, as they would, on a regular basis. It's really just kind of focused on those 400,000 that are, that have been extended due to the public health emergency. You know, one of the things, while it's not a written rule, but one of the things that our federal Medicaid partner has put out is guidance around, trying to make sure you're not doing too many per month. Like they have, you may have seen in there, there's some reference to like 1/9 of your caseload, of basically saying, when you look at your total population that you're gonna be renewing each month, to make sure it's not too large, right? Because obviously that can be difficult for clients, but it can also be difficult for staff and for the system. Thankfully, thus far, I mean, we'll see how long this public health emergency lasts. Based on the proposed schedule that we've put out, we are consistent, with those guidelines. But that is something we're definitely messaging to folks, and I know we're hearing a lot from other states too, is that, how close are you getting to that 1/9? And at some point, does it become problematic to where, it really is an issue of having too many that may be happening at one time? So, we're definitely continuing to monitoring it. We're updating that schedule. It seems like weekly, in terms of just as we look and see who's been extended and what that looks like overall. But, we have been briefing, legislators as one of our groups and others, just to let them know kind of what it looks like at this point, and then make sure they're aware of just kind of how that fits, based on the current end date for the public health emergency.
And,
Okay.
go ahead, I'm
Well,
sorry.
I want to clarify in my brain, or like, granted, it's 1.2 people on Medicaid now, but like, so you're saying for the rest of with the exception of the 400,000, like the other people aren't going to fall into that category. So technically, the redeterminations for them could be after the 6 months.
Yes.
So and you only know this based off of, or I'm trying to process it in my head, based off of like contact information that has went out to people to may show that they're not eligible anymore for coverage, or is it like, I guess I'm kind of confused.
Sure.
at
So
that
just
part.
to give a little bit more context on it. So at the federal level, CMS has put out, their proposed guidance around the unwinding. Yes, thank you, Amy. And basically, what they have said is they are giving states up to a total of 14 months. And within that 14 months, there's 2 months of what they call pre-work, right? Where basically during those first 2 months, you can go ahead and start the process. Because there's a lot of states that aren't like Arkansas that have continued processing renewals and doing eligibility throughout this time period. Thankfully, we have been doing that. And that's where that number comes from, which I'll come back to in a minute. But so as part of that, then states have the 2 months of pre-work, and then they have up to 12 months to be able to do all of those renewals that they either haven't been doing or maybe partly doing during the pandemic. For Arkansas, Act 780 requires that those who have been extended, that 400,000, that they have to be completed within that first 6 months. But everyone else, can and will go through at different times. And so when you think about that extended group, that 400,000, is really based on individuals who we have tried to renew, we've tried to redetermine them throughout the pandemic, and for whatever reason, right? It could be that we just never heard back from them, or it could be that the information we got actually said that, Amy was ineligible, or that we needed more information from Amy before we can make a determination. So we always make sure to tell people that with that 400,000, a lot of times people want to say, oh, so that's how many people are actually going to lose eligibility, and it's not, right? Because we don't know. We don't know why Amy didn't respond. I don't know why Amy didn't respond. But so that's where that 400,000 comes from, is really based on those individuals who we have attempted to reach out to be able to redetermine their eligibility, and for whatever reason, we were not able to do it.
And we will use those 2 months that the federal government is offering as well. We're going to use those as well. So we'll have 8 months really for our process, is how it's built out.
Okay, thank you.
Absolutely.
Nathan is watching online. He had a question. So the plans that you all received from us had some highlighted numbers in them, and they were highlighted because the numbers are constantly changing. And these were the most up-to-date numbers we had at the time we sent the plan. So Nathan's is just wondering, has there been any major changes in the numbers since they received that plan, or anything worthy of reporting, I guess.
They've gone up some, but not a significant amount. And I think that the plan is consistent with these. But those highlights were really for me as like if I have to give that out in 3 months, I want to go up and
Right.
find all the numbers I need to update. So that was my cheat sheet a little bit.
Yeah, I mean, largely when you look at the numbers, the two categories that remain the biggest are the our home group and then our kids A and B. You know, for several months during the pandemic, those two groups kind of went up and down in terms of which group was had more people in it that were extended. But really, for the past few months, it has been that our home group that has kind of been leading that effort. The other change I would say is with some of these numbers, particularly within within some of the disability-related populations, have actually been coming down. And I think that's a lot of the great work that folks here and others have been doing to try to work with providers, to try to work with associations, and say, hey, let's go ahead and get that done now, right? As opposed to waiting until next June or July or whatever it is. Let's get that done now. And so that's actually, I'm really excited about the fact that while those aren't necessarily the bigger numbers, we know that those are the individuals who are likely still going to be eligible for Medicaid, but just may not have been responding or whatnot. And so being able to get those numbers to start coming down in particular has been really helpful.
And if we do it now and they're found to be ineligible, they don't lose their coverage now. They still stay on until the end of the public health emergency. But I know Martina, they've been working with the nursing homes to get renewal packets, and they've seen already about 1,800 renewal packets come back since they've started this effort. So it is working to do that targeted approach.
I have a couple questions. One, when I read through it, is there a database keeping track of all these people? Because I know there's, I read through, there's a lot of, different, different gears in this, and a lot of different people, providers, PASS, clinics, hospitals, all these people. And so when someone finally does get in touch with somebody and they reach out, and is there like a checkbox that goes off so that people don't continuously reach out again? And then y'all kind of touched on it, but I was wondering if it'll check off and say, okay, we got in touch with them, so we don't have to continuously go after this same person. So that's one of the questions.
Yes, ultimately, whoever gets the information from the client, it will come to staff in our Division of County Operations. We will log it into our eligibility system and go through our eligibility determination process. And once the person is determined eligible, they will no longer be marked as extended due to the PHE. They will just be regular eligibility, and they will be on the regular renewal schedule for them, which is annual from that point forward. We have continued throughout the majority of the PHE to do our work as normal, as best we could as possible, and that, so you can see, with 1.2 million people eligible, 400,000 are extended. More would be if we had not continued to do our work. So that's why we are trying to do, reach out and do this ahead of time for folks who are currently extended, because once we do that redetermination, if they're eligible, then they'll just be on their regular annual renewal schedule after that, and we won't have to do them necessarily in that 6 months for the wind down. And if they're not, they'll still be extended, and we'll actually try to do another renewal during the wind down before they would actually lose coverage.
Thank you.
You're welcome.
And the other question I had is I noticed the other part of this was during COVID, there were a lot of services and different, it was at the back, I guess it's the SPAs. And some of them I noticed were things like being able to do assessments on the phone and being able to do some things virtually. And so I noticed that some of those are going to expire at the end of this month. So say, for instance, like I have a child that needs an assessment for, TEFRA or a waiver or something of that nature, and I'm on that list. Will y'all still be able to, because you're not going to be able to do everything in home. There's not enough staff to do it as it is now. Before the pandemic, there was hardly enough staff to come into the home and do a lot of these assessments. And, I did mine one was done in home and then one was done over the phone. But I noticed some of them are expiring at the end of this month. So will those things still be available to get people assessed, especially the disability population?
Several of them, yes, and then we can, if there's specific ones, we can definitely have some of our folks talk through that. But yes, there's several that we had said, really was based on the fact that it wasn't, at that point, there were concerns about, being in someone's home or, somebody coming in spaces that would have, multiple groups of people. So some of those have been set to end at the end of the year. But then there are others that we actually are continuing, throughout the course of the public health emergency. And then some that we are going to continue doing even after the emergency. Like we know that, for example, with telemedicine, we have learned a lot over the past 3 years. There's some really good things about telemedicine. We've also learned there's some things that probably aren't the best to do over telemedicine. But from that, we've been then working with our teams to come together and say, okay, what is it that needs to continue expiring at the end of this month? What is it, or at the end of December, what is it that needs to continue in the short term? And then what are those things that we want to continue longer term, even after the pandemic? But yeah, if there's specific things like whether it's around assessments, those, it's different across the different populations, but we can certainly talk about if it's around assessments or if it's around some of the provider-facing flexibilities, like there's been flexibilities that, for example, allowed providers to be able to access services without calling ahead and getting approval, and some things like that. So yes, we can definitely talk about any of those today, or if there's specific ones, we can also follow up, after today's meeting.
Also, I have a question about the technological changes that have been made to different systems. I know you combined Medicaid and SNAP information systems. And there's a Medicaid control center now. And also there's changes to the MMIS system and other systems maybe. Can you talk about that a little bit?
Sure, so I can start, and then Mary, you can add to that as well. But yes, so one of the things that we've been working on throughout the pandemic is launching what's known as ARIES, or the Arkansas Integrated Eligibility System. And really, this has been a tremendous effort on many parts, but especially doing it during a pandemic, but also getting all the programs together. Because I think many of you probably realized and felt, I know I heard from a lot of folks that did, felt, I think, the difficulty we had when we had multiple systems that were serving the same, yes, I see several nods, thank you, several programs. We know it was a headache for many of y'all and others, as well as for our staff. And so, throughout the pandemic, we had the choice to make. We were in a pilot phase when it began and basically said, do we continue moving forward and putting, Medicaid, SNAP, and then T/TANF in that? And we made the decision to say, yes, let's go ahead and do that. We're still working on, over time, adding other programs into that, like looking at childcare, talking with our friends over at the health department about WIC and some other programs that they have. But yes, so that is one of the things that we've been able to do during this period, is to be able to launch that integrated eligibility system. We have also then been really focusing on trying to get our other systems, eligibility now for the most part is pretty much all in one system, and then we all have the claim, we all have the payments and financial system over here, which is the MMIS system that really pays the bills, if you will. Really trying to focus on getting those two systems to talk to each other more, whether that's directly or as you mentioned, Jerry, with the control center, or having scheduled times where those systems come together to be able to provide us a full look at what's happening with that client or with that provider. And so that's really what we're trying to build out, is to be able to say, okay, we see on this side, we know that Amy's eligibility is good, right? But then we know that the providers are reaching out and saying, hey, I've been trying to submit for this service or for this, for this bill to get paid. And then, that's something that's normally been over here on the payment side. So we're trying to do more to be able to see both sides of that without having to look into, multiple systems. Mary, is there anything you want to add to that?
I don't think so, unless he has any specific questions.
Okay.
Any other questions from the council on this topic? The PHE unwinding plan, the THSS? Okay, go ahead.
DHS tends to have almost constant communication with providers because it's their profit center. You have communication with clients when somebody get their services cut off, because people are going to call and get mad. But there doesn't seem to be much community outreach, because there's no profit in that.
It's a challenge, right? Because I think about like even myself, whether it's my phone company or whoever it is, it's like I want it to work when I want it to work, right? Otherwise, I don't want to hear from them. So I mean, it's that challenge, right, of not wanting to over communicate, but also recognizing we may not always be the person in terms of at DHS that somebody wants to hear from, right? In terms of they want to hear from a provider, they want to hear from their pastor, they want to hear from their neighbor down the street. So that is part of what we're trying to do, I think, with these outreach grants, I think, is to try to see if we can get some more engagement from local communities in that. The other thing that we're doing, and we'll definitely bring it back as a future topic, but one of the things that our folks here have been talking about is, I think we are doing better at trying to talk more and just say, hey, make sure you know about this. Like, that the public health emergency is happening, and at some point we're going to have an unwinding. But one of the things that we realized is, there's varying levels of how much people really know and understand the services that are available and how to access those. And so that's something we've been talking quite a bit about and trying to think about, really focusing on as a team of saying it's not just about communicating, right? Because it could be like Reba, you said, it's like I hear from you all the time, but is that helpful? I mean, is that helpful? Like, is all that information you're getting, is it of value to you? Is it useful? And so really trying to think about what other information would be helpful in terms of about services, about benefits, about how to access some of those, about what does it mean when, yes, this says I have information that says I can use this service, but how do I go about doing it? Do I have to call someone? Do I have to get a referral? What does that mean? And so that's really what we're hoping to be able to focus on as part of our next phase with regard to communications and outreach. And like I said, definitely, encourage, as y'all have thoughts, between now and, likely our next meeting, would love to hear from y'all. But otherwise, that is a topic we do plan to bring back and really hope to get some, some engagement and feedback from y'all.
And I will say, if you all have like specific organizations that you think we should be reaching out to related to the PHE, Jason and I are both working on kind of doing stakeholder outreach, and we've already started that, and people are engaged. Like the week before, we had a really good conversation with librarians from across the state, because they, clients are going into the libraries to maybe use computers or whatever. So we are trying to have those conversations, and would love to hear if there are local organizations that you guys think we should be reaching out to, just to make sure they're on our list. There is that kind of balance where we keep saying, it's about to end, and then it doesn't end, and we're worried that, we'll be crying wolf a little bit. So we're trying to balance that, and I think everybody has expressed to the federal government, like, certainty would be helpful, so we could actually plan and decide what we need to do and when we need to do
How
it.
much outreach do you do to retail operation, retail stores?
You mean in terms of like
Walmart,
a Walmart or Target? So in some communities, our
Large
in some,
pharmaceutical operations?
Yep. So in some communities, we do have good participation, whether it's through local civic groups and organizations, and are able to, help interact with the business community through that perspective. We also try to utilize through our contracts that we have, which does include whether it's, pharmaceuticals or other types of services, to make sure they know about it and are helping get information out. But as Amy said, I mean, we are always looking for ideas. If there's thoughts or suggestions, or if you all have individuals in your community that would be interested in learning more about how we can connect and work together, we would love that.
One opportunity that you do have coming up is tax time. I don't know if you've ever thought about reaching out to tax offices, because they serve a lot of the community that comes in, getting EIC credit and things like that. But you are right in the aspect of, DHS is probably going to have to advertise, but you can place in front of someone every skill, everything, but until they have a reason to be engaged, people aren't going to pay attention.
Yep.
Well, in Pine Bluff, we had a retail store, a major retail store closed in Ward 1, which has now created a food desert in that ward. People in the community are very disappointed, you know. I would think that if DHS could maybe work with some of the retail stores, we could prevent food deserts a little bit more.
Yeah, that would be great. I mean, I know one of the things, and we're doing it in a few communities, and Mary can add if anyone is interested or we can get additional information. But we have been working in several communities, like with local grocery retailers and other retailers, particularly around the SNAP program, and being able to help think about, you know, if they can utilize, you know, SNAP at places people might not think about, like whether it's a farmer's market or if it's online, right? Like we know during the pandemic, a lot of us, you know, shifted to either, you know, getting groceries online in terms of having them dropped off at our house, or to go and pick them up, right, without actually having to go in the store and, you know, go through the aisles and everything. I will say I'm a big fan of that myself. But, you know, along those lines, we've been trying to work within some of those retailers to say, okay, can people use SNAP to be able to do that, right, as opposed to traditionally having to go in, go through the aisles, and then, you know, check out with their card. So,
And I think Amazon and Walmart do it. Right?
Yeah, we actually, before the pandemic, USDA had a pilot for using EBT to purchase online. And I think there were about 5 states in the pilot, but FNS expanded it to other states and we joined that pilot. So now our SNAP clients can use their EBT benefits to make online purchases at providers who participate in Walmart and Amazon, our providers. But there are others as well in Arkansas now. There's several, I can't name them all, but that is something that we did expand during the PHE, and we were happy to have the opportunity to do that. We also, I mean, before the pandemic, we also expanded our footprint in farmers markets. There's a process that farmers markets can go through to be able to accept EBT for those local vendors and local fresh food products. We also have we work with the Arkansas Coalition for Obesity Prevention and Hunger Relief Alliance for what's called a Double Up Food Bucks program at several farmers markets, where there is a grant that provides, you know, if you spend $10 on fresh fruit, then you get like a token that you can use for 10 additional, the value of 10 additional on fresh fruit and vegetable products and things like that. So those are some things we have done, but definitely understand that there are still areas where you would consider it a food desert, or, you know, easy local access quickly. It's not necessarily available.
yeah. But, you know, something I just got to thinking, Jerry, about your question, and Amy and Jason, y'all may have already reached out to him, but if not, thinking about, like, whether it's Rotary or Kiwanis or some of those groups, right? Like, I think trying to, you know, be able to reach out to folks that may not traditionally, you know, think about or be involved in the work that we do, but, you know, would be able to help, you know, either represent some of those business communities or help connect us to some of them. Because I know we've got, like, our county administrators in many of the counties across the state participate in those, as well as I know we have some folks here, as well as throughout DHS, that participate in those groups. Yes?
I have a question about the continuity of coverage thing. And I guess this would be more on the next slide, but let's say you get a renewal letter it's the renewal letter asking for your information is April the 25th of next year, and it's dated May the 1st, or you get it May the 1st, you know, and then you have medical services between on the May the 2nd through the 16th or somewhere, and then on the May the 17th you're determined ineligible, and then you receive that decision on the 24th. So when would your Medicaid coverage end, and how would they assist you in getting coverage so that any medical services you've received wouldn't just be completely uncovered?
Certainly, and so I'll let Mary talk about the specifics, but I think, in general, we recognize that the mail can be challenging, so I'll let Mary talk a little bit about what we do to try to deal with that, but also the fact that, most of our programs also have retroactive eligibility options. And so, Mary, if you want to talk a little bit about both of those.
Sure. One of the things we did and planned to do even before the pandemic, as we launched our new eligibility system, was mail those renewal packets out earlier than we did before. So in our regular categories that don't involve both the financial determination and a medical determination, we mail those packets out about 90 days before the renewal is actually got to be processed. So, and then we send reminder notices if we haven't received that packet. And for our categories in the long-term service and supports that have financial and medical determinations, those go out about 120 days ahead, so almost 4 months ahead. And as long as we have received the packet, the case would not close, even if for some reason we had not finished the determination. As long as we have received that packet, the case will stay open. Now, when we do make a determination, and let's say someone goes ahead and turns their packet in early, which is great. We want them to turn them in as soon as they receive them. Even if that results in an ineligible determination, that case would not close until the end of that renewal period. So, if your case is going to close, you will get an advance notice of that, and it will tell you the last date that your Medicaid would be active. Mm-hmm. Okay?
Right.
And then, as Dawn mentioned, retroactive coverage with our, especially with our MAGI renewals, but if we needed additional information to complete that renewal and we don't receive it and the case does close at the end of the renewal period, as long as we get that information within 90 days of the end of that renewal period and we redetermine you eligible, then you actually don't lose coverage. We go back and backdate that coverage so that Medicaid will go back and pick up from the day that it ended in that case. And then if someone does become ineligible and they reapply, most of our categories can go back 90 days as well at initial application.
Of course, I guess what I was thinking about is, let's say someone moves from AR home to the Affordable Care Act. If someone moves from their income level since the start of the pandemic and all that, moves from the Medicaid level to the Affordable Care Act level.
Yep, go ahead.
In that case, if someone is determined over the income for our home, it's called an account transfer. We send that information to the marketplace, and we also send that to our client and says you have been determined ineligible and refer you to the marketplace to apply for and enroll in coverage through the marketplace. So, and that's another reason why it's important, even if people don't think they're going to qualify, if they go ahead and send us that renewal and we make that determination you're over the income limit, we're going to send that information to the marketplace to help ease the process of getting on a plan through the marketplace.
And I'll just add one other thing to that. The good thing about the way our program is set up here in Arkansas is that, like, let's just take Blue Cross as an example. If Blue Cross is your plan through our home, right, through the Medicaid program, and you're determined ineligible due to income, it's very likely that then if you're happy with Blue Cross and you want to keep going with them, we send that information to Blue Cross as well. So Blue Cross can then say, okay, I see that Amy has been determined ineligible. She's not eligible for Medicaid anymore. So I'm going to see if Amy wants to go ahead and sign up and get a Blue Cross plan through the marketplace.
All right, we're over time for this section. I'm going to let Michelle ask one final question, then we're going to get to a presentation on Access Arkansas.
So mine is kind of similar to what he's asking as well, but specifically towards, like, for instance, for kids with disabilities that may be going from a regular, like right now, for instance, our children all have disabilities and we're on, regular Medicaid. They were on TEFRA before, and then we were on, the regular Medicaid. So I imagine when this ends and we send stuff in, that they may be we may be going back on TEFRA, And the thing I worry about is with that going back and forth that we've had because of the pandemic and losing jobs and all this, upheaval that a lot of people have experienced over the past few years, is there's a, even though Medicaid has all that information, my son's been disabled his whole life, they have to go through this whole series of information that can sometimes take 90 days or more. When they have the information he's disabled, been disabled his whole life, is there a way to streamline that when we may be moving some families from one program to another program? And if the information's been there, will we have to go through the same process with, because like it's the same thing with Social Security. I think a lot of people have complaints about is constantly having to re-verify that you're disabled. When
Right.
you have something that states, okay, this is a lifelong disability, why do you have to keep telling them over and over that I'm disabled this year, I'm disabled the next year, I'm disabled for the next 20, 30 years? Is there any way or plan to make that easier where like that 90-day process that my son may be receiving, for instance, his diapers, his respite care, his, ABA, speech, OT, and then for 3 months, there be like nothing. And that would be, pretty disastrous for a lot of families. And I know families that are experiencing even before the pandemic with that gap between going from regular Medicaid to like Tefra or something else.
No, it's an excellent question, and I know Melissa or Elizabeth may want to add as well, but that's definitely something that we've been working on, particularly with the passes, where somebody either, even aside from the public health emergency, whether it's somebody who has been served by us somewhere else within Medicaid or previously with the pass program, where we're trying to make sure like things like those person-centered plans or previous, service information can also help transfer, right? So you're not starting from scratch. So that is definitely something we've been working on. I know there's a lot more that we need to do around that, but I don't know if either of y'all have anything you want to add on that.
Yeah, the only thing I would add, can you hear me without a microphone? Is that with the TEFRA renewal, which we submitted to CMS and we're waiting on approval, for those that have a disability like you're talking about, that's one of the 6 categorical disabilities that qualify you for the waiver that Melissa serves. You'll go through a 3-year renewal process instead of an annual. So we are trying to make that a little easier for individuals who, like you said, are not really going to have a change in circumstance.
Right.
So.
All right, Amy, Dawn, thank you.
Thank you.
A lot of good questions from our council members, a lot of good answers from you, so thank you. One of the things that was alluded to, I think Cassandra brought it up, Nathan has texted me a question about staffing levels and whether we'll be able to handle this unwinding of the public health emergency. You were all asked to review some Access Arkansas videos. Access Arkansas is one way that we hope our clients can limit the burden on some of our staff by doing some of the things online. And these videos help educate the clients about how to do some of those things online. So I'm going to invite our Division of County Operations Director, Mary Franklin, to the podium, and she's going to entertain some of your suggestions on what you thought about those videos, how we can make them better, if they were helpful to you, and Mary can tell you more about Access Arkansas.
All right. So just a quick recap of what Access Arkansas is. This is our website that clients can use to apply for benefits, make changes to their cases, renew their benefits when it's time, and also to upload documents that may be needed. And so we expanded what Access Arkansas can do. When we launched our new eligibility system, we enhanced what you can do online to give clients the ability to have some really robust self-service ability. Not that we're not still available, as we always were, at county offices, on the phone, through the mail. We still have all those avenues for people, but we also now, through this website, have the ability to let clients actually check the status of their case and all those other things. So we had created, with the comms team, did the huge heavy lift on creating these videos that really break all of those things down into small videos about one thing, like how to create your account, and then how to link your cases to your account, how to upload information. And so I just really wanted your feedback on those videos that you watched, or is there anything in particular you want to hone in on, or suggestions that you might have related to those videos.
Well, excuse me. I know somebody that tried to set up an account last night, and they couldn't set up an account on the website because they've never had any credit. They don't have a credit history, and they said it's connected to credit history. Could you fix that for people like that? Because there's a lot of people that's been disabled that's never had any need for credit.
So I'm going to make a note of that and take it back and just provide a little information. We do have something built in that it's called remote identity proofing to help protect people from identity theft and fraud and being able to create an account as if they were some other person and have access to some other person's information. And part of that process is a series of questions, and we do this through the Federal Data Services Hub, and there is if it doesn't work, if you answer those questions when you're trying to apply or do something like that. Now, creating an account doesn't take you through that process, but once you try to apply and link your cases to that account, then it will take you through this process. If you can't answer those questions, the system gives you a phone number and a reference number to use to call, and you would call Experian is the company that does that remote ID proofing for us, and then they will try to help you resolve it over the phone. But if there are issues after that, is that what you're saying? Even after calling the number?
Yes, they
it
called the
wasn't
number.
successful?
They called
Okay.
the number, and that's what they told them. They said your problem is because you don't have you've never had any credit, and they said it's based on your credit record. And they said, well, what are we supposed to do about it? And they said, we don't know. It's based on your credit record. They said that was put in place years ago before they ever expanded it to that.
So I will take that back to see if if in a situation like that where credit records are not going to be useful to verify identity, if there is something we can do to help with the workaround. But I do want to stress, that doesn't mean that person can't apply or can't report changes and things like that. They just may have to do that through the county office or on a paper form or email us if they can't get through the remote identity proofing.
Well, it would be a good thing if you could do a workaround where you didn't have to have the credit score or whatever, because I've looked at just about all the videos yesterday. That is a good website.
Thank you. And I will take that back to see if we can come up with a workaround for those particular situations.
So Allison, our chairperson, couldn't be here, but she did email me some suggestions after watching the videos. Regarding the first video, if we could scroll down just to show it's kind of or scroll up, I guess. That one right there, she said it needs a title and what to expect when you watch, kind of the intro video.
Okay.
She said none of the screenshots, I don't know if we need to play the video, but for those of you who watched it, in her opinion, some of the screenshots weren't up on the screen long enough to digest the information that was being presented. She loved the animation that starts around 1 o'clock. She said, or 1 o'clock, around 1 minute into the video. It was very clean and very nice. And she added that it could say up front who can use it. In the past, it wasn't set up for a parent to use for a child's information, but it looks like it is now, so it needs to say that. The next video was setting up access video. She said for parents, it's not clear whose info goes in the fields, hers or her child's. So the information fields that are set up. She said that wasn't clear. And she had a few others that I can share. I'll email you the suggestions that she offered.
Yes, please do.
But does any other council members, after watching the videos, have any suggestions or thoughts on them, how they can be improved, what you liked about them, were they helpful? Yes.
I just want to tell you, it's phenomenal compared to what there was previously.
Thank you. Our goal was to make it much, much better.
And I actually used it because, like I said, I know that it's still the public health emergency, but I kept getting things in the mail and not knowing what to do with them. So I finally got on there and I was like, okay, they're asking for something. And it was something very random. But I was able to find it because they wanted it from 2 years ago. So I was like, okay, well, let me see if I can find this 2-year-old document. So I found it and actually uploaded it. And it was pretty immediate So I was able to, when I finally found it, I got it in before the deadline, submitted it, and then within a week, I got something from Medicaid that said, yeah, we received it, and this is what we determined, yada, yada. So it was actually really nice because it was, so quick. It was not waiting 30 days or 60 days or not ever hearing anything from them when you send them a document or no verification. So it was nice to see it uploaded. I knew it was done. I knew I had proof it was done. It didn't get lost in the mail, none of that stuff. And then I immediately got a response back that, okay, this is what we did with that random paper, and this is what we determined. So I like it. I know it's, there's a work in progress, and hopefully there will be some more Medicaid programs added, which would be great. So that way, and not only Medicaid programs, but other programs added to make it like a one-stop shop. But I think it's so much easier, and hopefully it'll help with a lot of this. And the videos are really good. They were to the point, and I'll say also for what Allison had said, is I did notice that too when I'm trying to fill out stuff. I can't tell whose income they want because, if I'm filling it out, I can't tell if they want mine or if they want my child's income. And it's the same thing kind of like with Social Security too, where they count so much of this income or they want that. It's always confusing because they just say, what is the income? They don't say like, what is your child's income? Well, then of course that might be zero, but it always says, what is this income or that income? So that's part still was confusing when I was filling out information on there. So I wanted to say that I saw that as well and couldn't tell.
Good, and I'm glad you saw, you uploaded and you got the green check mark success, so you knew for sure we had your document and it was there and we would take action and let you know the next steps. That was one of our goals. We still want to be available, and if you need to mail us something or you want to bring it to the office, we're here, but we also wanted to have this ability for people who this is convenient for, to save you that trip, save you that postage and those kinds of things, and the chance that, occasionally either it could get lost in the mail before it gets to us, or it gets to our office and occasionally it might not get scanned. It might go in the shred box instead by mistake. Not that we ever intentionally do anything like that, but anytime humans are involved, there is going to be some element of mistakes that happen. So this helps to avoid those kinds of things for clients where it's convenient for them. And I would like to hear more specifically about enhancements or additional features. I can tell you that this is already available, not just for Medicaid clients, but also for SNAP clients, because we have now fully implemented everything into our new system. So at first, it was just for the Medicaid, because Medicaid was all that we had moved into the new system. But now everything's in the new system, so it works at the same time. So if you are going in to report an address change and you happen to have more than just Medicaid, or then that address change is actually getting taken care of for all your programs. Same thing about income or anything else you might report that's changed. If you have more than Medicaid, we will take the action on all the cases that it impacts from that one change report. Okay.
Is there a way on the website for you to see if you're in like the 400,000 and you're going to be at risk of being cut off like AR choices?
So one of the things that you have access to when you create that online account is any notices we have sent you since we launched the new system. Now, if you had cases before that, we don't have the historical notices, but anything we have sent you, letters or notices, you can look at them through your online account, and those letters would have told you were ineligible, but we've extended your case due to the public health emergency. So yes, all that correspondence, you would be able to see that through your online account.
So anything mailed to a client is also posted on their online account if they
Yes.
check? So you wouldn't have to rely on the Postal Service. You could look on your online account.
Yes, and you can actually sign up for email and text alerts if you choose to do that, to be notified anytime we send you a letter. The text and the email is not going to have all the details, but it'll tell you we sent you something so that you can log into your secure online account and look at that notice through your account.
Will documents be permanently saved? Because I know like in the past, I've had issues with like documents getting lost through the DHS office. Thankfully, for the county that I live in, they had an email address that you could mail it to. So at least I have a receipt on my end that I sent over this
Right.
document. But is it going to be stored online just that it can be referenced back later, maybe by the case manager?
Yeah, yes, whether you upload the document yourself because you've created an account and you uploaded it directly to your case, when we scan it, it goes directly to your case. So once we get it, and, you know, if it got lost or we never got it, then it won't be there. But once we get it and it's scanned, it will go to your case. Yes.
A lot of low-income people don't have access to computers. I mean, a lot of people have cell phones, but not everybody has a smartphone. But anyway, there are a lot of public access points to computers that are provided by the different state agencies and local libraries and so forth. Have you reached out to these public access points? Make sure they allow people to access Arkansas?
Well, and you make a very good point. And one thing I also didn't mention, but probably should have, is our Access Arkansas website is mobile friendly. So you don't have to be at a desktop computer. You can do it from a laptop or from a tablet or a smartphone. And we have kiosks in our lobbies. So if people want to actually come and use the computer at our office, they can do that. And as you said, there are a lot of public places where people are allowed to use the computer. And in the past, we have had discussions with those, like the libraries and things like that, and collected information about where public access computers are. And it's actually part of our resource directory on Access Arkansas.
If you go to the Department of Workforce Services to apply for a job, can you access Arkansas from their computer?
As long as it's a place that allows public use of their computers, yes, because it's just a web address. You don't need anything special to pull up accessarkansas.gov. So any place that has the internet.
I know they usually block access to a lot of
Well,
websites.
if that's the case, then we need to just make sure that they allow the use there, you know, for those websites.
Well, I mean, it
Yeah.
just seems kind of strange if you go to a state-funded computer, but you can't access certain state websites.
Yeah, and you know, I will take that back because we do have a relationship with Workforce Services and Career Education, and just make sure that Access Arkansas is one of their allowed websites at their sites. I'd be glad to do that.
Any other questions? Yep.
To piggyback off what he's saying, are there, I know at, you know, the DHS offices, most of the time you're going in to work with somebody, but are there some that have tablets or computers available for people to do that stuff if there's not a local library or a local place for computer access? Would there be something like that to make it easier and streamline the process, another point of contact for them to access a computer to sign up for these things, or someone to help them sign up for it, which may be quicker and easier than going through the paper part of it. You know, will DHS also be utilizing it to help people set up an account or go through that instead of doing everything just paper, or, you know, doing those kind of things? And that way you're not only you're helping set this up, but you're teaching them how to hopefully use it on their own as well.
Yes, we do have a kiosk, at least one kiosk in all of our lobbies, and we have it's a station on the wall, and there we have privacy screens too that you can pull around so no one can see what you're typing. So we do have those in our offices, and our staff will help if someone asks for help or needs help and wants to do it that way. Then yes, we will definitely help.
Mary, do you also want to talk about the community partner portal?
Yeah. In addition to the Access Arkansas for our citizens, for our clients, we also have a community partner portal that works in tandem with that citizen portal. So partners, as Chair Watson mentioned, you know, the community organizations, there is a way. We have a toolkit on our website similar to this client toolkit that you're looking for, that community partners can use, and they can sign up with us. They can apply and sign up with us to become a community partner, which basically means that they can have their own login to Access Arkansas, and any of our clients who have an account online who want to give that community partner permission to access their account, those community partners can also help clients apply, report changes, upload documents, check the status of their case. So that is something that we do have. We have several community partners. I couldn't give you a list right now, but we take applications, and that is something that we talk to partners with when we get questions. We have not done a full-blown campaign at this point to enroll community partners, but it is available, and we do look forward to expanding that ability for partners that want to be our partner and are willing to do those services for our clients.
All right, we're going to break for lunch, but we have one more question from Bradley before we do.
I just have a follow-up to another question. If you send me a notice and say, we need a financial bank statement from you, and I upload it on the website, will I get a notification saying that you received it on the website, or?
Yes. Get a green check mark, and you can see it there, and you can take a screenshot even of that screen if you wanted to. But yes, you do get a successful.
Well, the reason I was asking this because I know stuff's bad about getting lost in the mail, but I didn't know if there would be a verification on the website or not.
Yes, you will get a success check mark and information that says we received your document right there online as soon as you do it.
All right, thank you, Mary.
Thank you, everyone.
So after the break, Jerry mentioned partnering with private industry. We were going to partner with you guys as far as messaging. You're going to see the video that you guys helped create, and we're going to have some ways that we have some ideas on how you can bring the message back to your community and help us with our messaging. Before we break for lunch, I want to thank some of the directors who are here who aren't scheduled to speak. Elizabeth, Jay, Martina. They're all here because a question could pop up and they have some institutional knowledge where they could help. So they're not presenting to the council today, but they're here as a resource, and we appreciate them being here. They may present in future meetings. Some of them have presented in past meetings, but we like the collective wealth of information that DHS commits to these meetings, so we have the ability to answer any questions that you all raise, and they can bring back some of the suggestions to their divisions that are offered. So why don't we break for lunch? We're going to take a half hour, and when we come back, we'll resume the agenda. All right, welcome back to the second half of our meeting. Hope everybody enjoyed your lunch. You may or may not know this, but November is National Family Caregivers Month, and here in Arkansas, it's also been designated as Lifespan Respite Awareness Month. We're going to learn a little bit about what respite is. Fun fact, I am a certified respite provider. I went through the online training. There was someone who had contacted DHS. She seemed like she was at her wit's end. She didn't qualify for help to come in the home because they had made too much money. I learned about this program. I thought, I'm going to go through these online training videos and get trained and then offer my services. She ended up opting out of that idea because she just doesn't really want people coming in the home due to COVID and other reasons. But I thought it was a good thing to learn about respite anyway. So I'm certified if any of you all need a respite provider in Pulaski or Saline County. And the neat thing is, it doesn't matter how much the caregiving or how much the family makes income-wise, there's money available regardless of income. So DHS Deputy Director of the Division of Provider Services for Quality Assurance, Sarah Schmidt, is going to tell you all about that program and more as she addresses you and takes your questions about respite care in Arkansas. Sarah?
Thanks, Jason. I know. DIPSQA is a mouthful. That's why we say DIPSQA. Good afternoon. I almost said morning, but it's afternoon now. Thank you guys for having me. I am going to talk to you about what, unfortunately, we call the best kept secret in Arkansas. I say unfortunately because we don't want it to be a secret. So that's why we're talking to you guys about it today, which is our Arkansas Lifespan Respite Program. As you can see, I was supposed to talk with you guys back in July about this, but I actually got sick during that council meeting. So luckily, Jason was kind enough to put me on today's schedule. So just to tell you a little bit about where this all started, in 2006, federally, they did the National Lifespan Respite Act. So the U.S. Congress and Senate formally identified the Lifespan Respite Act back in 2006, and it has been carried on through this time. In 2013 is when we kind of started looking at it here in Arkansas. So several service providers, advocacy agencies, and DHS got together to look at respite across the state. and where we may have some gaps. Through that, we kind of started looking at where we could possibly find some funding and other things like that. We applied for our first federal grant back in 2014, and we've been receiving federal grants ever since. Our last one we received in 2020. It's a 5-year grant for $1.3 million. So I'll kind of go over with you guys a little bit of what we're doing with that grant. But first, let me just talk about respite in general. Is there anyone here who doesn't really know what respite is? Or a lot of times you'll hear people say respite, different things like that. Just the general overall respite term is it's a short temporary break. What we use it for with lifespan respite is that same thing, but lifespan respite is really geared towards bridging the gap. So there are several Medicaid programs in our state already that provide respite as a service, and we'll go through some of those here in a minute. But there are also individuals out in the state who may not qualify for Medicaid or who may just have a temporary issue, and their caregiver gets exhausted, gets overwhelmed, and just needs that break. So lifespan respite is the same type of respite, but it's really for any age and any disability or serious chronic health illness. So it really is meant to bridge that gap. So where you can find respite within our services already, there are several Medicaid programs that already include it, like I mentioned. DDS has several areas where respite is included. I think through the PASS program, they allow some respite, and through some of the DD waivers. DDS also has a waitlist voucher program. So if you are on the wait list waiting for DD services, they have a voucher program. The thing with that is it does require the DD diagnosis to receive those respite services. AR Choices, or R Choices, is another program that also has respite services in its line items. That again also has the requirements that you have to be, and I hope I'm getting this right, 21 to 64 years of age with a physical disability, or 65 years or older. So again, there are those restrictions there on who can use that. And then also DCFS in our foster care system also uses respite. So lifespan respite is not a Medicaid service. It's not paid through Medicaid. It is federally funded through our grant right now. So it does not require that Medicaid eligibility. We have several people who come and look towards our respite if maybe, like Jason mentioned, they make a little too much money to qualify for Medicaid. They may be on a wait list of some sort. Or they're on one of these Medicaid waiver programs and they've already exhausted all of the respite that is in their plan, and an emergency comes up. So they need respite, but they've already exhausted what they have. So we work with all of those to fill in those gaps. So what we're doing with the grant, we've kind of given it an analogy here of the three-legged stool. So if you think about it, there were 3 areas that we wanted to tackle and make sure that we were focusing in on when we built this program. When you think about a stool, you have to have at least 3 legs for it to stand. If you pull one of those legs out, it's going to be wobbly. Some of you may have sat in a 2 or 1-legged stool, but I haven't been able to do it. So the 3 areas that we're looking at is the ability to pay for respite care, a workforce for respite care, and then the ability to easily find those workers. So those are the 3 areas that we wanted to tackle, and I'll go through a little of those one by one here. So first we'll talk about the ability to pay for respite care. This is where we started, was with vouchers. We knew that caregivers in the state did not have out-of-pocket money to pay for respite care on their own. So through our grant, we've developed a voucher program. You can apply for our vouchers. They're $300 that are paid directly to the caregiver, so that you can go and what we call self-direct and find your own respite provider. So you use it however best fits your needs. Some people use it in-home. They bring in family, friends, neighbors who are comfortable with that individual already, who they already have a relationship with, to provide that care, and they can pay that person that $300. Sometimes they choose to look at a long-term care facility if they need an overnight stay or a weekend stay while that caregiver goes out of town, and they can pay that out of pocket to the facility. There are various different ways you can do that, and we've left it open so that you guys can figure that out based on your need and your preferences as a caregiver and as a family. So these are the criteria. You can see it's a short list. This is the criteria that we have for our vouchers. You must live in the state of Arkansas. The caregiver has to provide full-time, unpaid weekly care. The care recipient has to have a special need or chronic serious health issue. And then if you receive respite through any other funding or programs, like we just mentioned earlier, that you have used those fundings first and then came to us. That's it. That is our criteria. The application is online. People submit those either through email or through fax to us. All that we ask is that you provide some documentation of the diagnosis that is going along with this. It does take a little time at first. If this is your first time getting one, we have to set you up with a vendor number. There's a lot of little pieces involved. But once we get that and you receive your first voucher, you can then reapply every quarter. So a caregiver can receive up to $1,200 in respite voucher funding to pay out-of-pocket respite care. So we started providing that, and it's going really well. It's really starting to pick up. But then we started hearing from people, great, I have this money, this is wonderful, but I don't know where to find somebody to help me utilize it. So we started looking at the workforce that's out there and then how to help caregivers find those individuals. So this was really a two-pronged piece. We were fortunate enough last year to be invited to a multi-state pilot program to develop a national respite training. It's online. It's totally free. You can sign up for it. We went live in January. It's what Jason was talking about that he went through. It's self-paced, so you can go through it at your own pace. There's an initial introduction. Once you complete that, it will open 10 modules that go step by step through certain topics, some of them nationally and some of them state specific, such as our laws and regulations around respite, reporting maltreatment, different things like that. Once you go through those 10 modules, there's a comprehension assessment. You have to score a specific score. I don't really remember what that is at the moment. But once you do that, then it unlocks a certificate for you. So that is one way that we are trying to train the core standards of providing respite care. During that time, we were also looking at how can we let caregivers know who is available out there. We have a spreadsheet that we kept in-house, and we often joked it's kind of like the special menu at the In-N-Out Burger, if any of you have ever been there. You got to know it's there to order off of it. So if you knew we had it, you could call us and say, hey, can you send me that list of the respite workers you have available? So we wanted to get that out. We wanted to make it public. So we created a search locator online. It's on DHS's website, where you can go and you can filter by several different topics or criteria, such as your county, how you want to pay for it out of pocket, if they accept Medicaid, different things like that. But when we began to develop it, we needed a way to verify that these people had some sort of skill. In the beginning, it was just service providers and agencies who we had on the list. Luckily, the online training came around at that time, and so we decided with that certification that you can now receive through our online training. If you receive that certificate, then you can request as an individual, or what we call an independent respite worker, to be added to that search locator so that caregivers can type in Jefferson County and pull up anyone agency-wise or who have completed our training. To look through there, they provide a lot of different information. For example, any skills that they may have. If they're CPR certified, they can kind of then sell themselves to you in a sense. And that is a very brief overview of it. And I talk really fast, I apologize. But where can you find it? I wanted to leave some time if you guys have questions. If you go to the DHS website under the Division of Provider Services and Quality Assurance page, there is a Arkansas Lifespan Respite page. From there, you can click on applying for a voucher, finding the training, or the search locator. You can also just go to ar.gov/respite, and it will bring you to those pages as well. Okay, and I'll end there and see if you guys have any questions. Yeah.
So is the voucher paid directly to the care worker, or is it given to the parents and then they pay them? And then
It is paid directly to the caregiver, and then when I say caregiver, I'm talking about the primary caregiver, the parent, or the individual who's providing that unpaid care, who's needing the respite.
Okay, and is this a tax-free?
So we do set you up as a vendor for DHS, and I don't know all of the. Okay. So yes, you do have to report that as income. I don't know all the logistics on that, but the first one voucher is $300. You can get it 4 times, so it's up to $1,200 if you receive all 4 quarters.
So if someone gets respite like through the PASS or the waiver program, it's different than this, correct?
Correct.
How does the respite work through the waiver or the PASS program? Do you know?
And I'm turning that one over to Melissa. You knew it was coming.
I know. So in order to receive respite under the PASS, whether you have a behavioral health diagnosis or an intellectual disability diagnosis, respite's available to any PASS member. You just have to request it from your care coordinator and have respite added to your person-centered service plan. I will tell you that I was just messaging back and forth with Dr. Staley that we are seeing very low spend in respite under the PASS program. In terms of the providers who want to provide respite. So we've been out actively recruiting providers to enroll as respite providers, and now I know Jason Peterson, maybe I could get him enrolled in Medicaid.
Do the providers, like take for instance, Focus or one of those type of providers, do they not provide respite care through their employees?
So they can. So respite for under on the IDD side of the house falls under that broad supported living service. And so if you have direct care workers that work for Focus, they can provide supported living or they can provide respite. I think what I'm seeing a lot of is they're calling it supported living, right? And so I think that's why we're seeing such little spend. But when we think about respite, it would be nice if we could get to the point where what Sarah's talking about, which is you could really give parents and caretakers a break, you know, even if it's for a weekend, and do true respite.
Yes, so you can apply for each child.
Okay.
Yes, I want a clarification on something. We were told about, 6 months ago about this respite thing? We've never done it. But my mom is my caregiver. Would she not qualify to have respite care for me? Because it says something on the sheet she said about unpaid caregivers.
So through the Lifespan Respite Program, yes, she would qualify.
I think one of your slides, the first criteria was you had to keep going back, right? The second one, caregiver applicant must provide full-time unpaid care weekly. She's saying she's a paid caregiver. Could she qualify for this?
But when you're not being a paid caregiver, you're providing unpaid caregiving. So I'm sure that adds up to enough time. Yeah. You would still qualify.
Any other questions about the respite care program and who would benefit from it? Or one of the neat things I found going through the training is you get to negotiate with the caregiver you find. You could pay $60 an hour and get 5 hours of care, or you could pay $10 an hour and get 30 hours of care. You can negotiate. And I selected Saline and Pulaski County, so anybody searching in Lonoke County, I'm not an option. But anyone searching in Saline or Pulaski may find my name and give me a call, and we could start a dialogue of what are the needs. You could specify an age group that you want to care for. The caregiver can specify an age group. I don't want a teenager coming in. I want a mature 40 or 50-year-old, you know. So there's a lot of empowerment given to both sides, really.
Mm-hmm. And another thing that we're, once we built it, we're already thinking about enhancements. One of the things we're looking at now that we have the core skills kind of set in stone is building what we're going to call badges. So building more online training, maybe if you're interested in really working with the Alzheimer's population. We can build out some type of Alzheimer's training to better help you get skill in that. So we're looking at all those different categories, so then a caregiver can list on our search locator, yes, they've done the certification, but they've also received badges in all these areas. So if you're looking for someone who, say, can do tube feeding, if we had a tube feeding module on there that had a badge, you would know they've gone through and completed that.
All right. Well, thank you very much, Sarah, for that presentation. The next item on our agenda is a big reveal, because many of you participated in some interviews we did in the Capitol View room a couple meetings ago. We have created a video from those interviews, a video that we're not ready to use yet because the public health emergency can has been kicked down the road again. But when we do get to the point where we're ready to use it, we wanted to give you an idea of what we're going to show. So Gavin is going to talk about not only that video, but also some other ways that we think you guys can help us with messaging once this wind down begins.
Thanks, Jason. And yeah, this is really exciting. We're thrilled to be able to show this to you. So I think we'll get it queued up. And what I'd like to do is let you all see the video and then have a conversation with you about what you think, if you like it, if you think we should make some changes. Also, I don't know if there's anybody here who didn't participate who wants to. Stephen is here again, and we can still add to this video. But after we watch it, we'll get some thoughts on that, and then we have some ideas about ways that we would put this out into the world once we shift to our Renew Arkansas campaign, which is the one Amy mentioned, really focusing on encouraging people to send back their renewal information. You'll notice it's branded that way, but is it good to go? All right, well, why don't we play the video, and then we'll talk after.
My name is Cassandra Glover.
My name is Frank Helmer.
My name is Deronda Elaine Williams.
I'm Bradley Ledgerwood.
My name is Jerry Watson.
My name is Erika Buenros. I'm Allison Caballero.
My name is Reva Shipley.
I am Dr. DeAndrea Bass-Kerrigan.
Medicaid matters to me because it allows myself and my son to get necessary health care treatment.
Medicaid matters to me because it allows me to stay at home and be on the city council and in cash and be really active in politics, which I enjoy.
And Medicaid matters to me because I know that when my kids are sick, I'll be able to take them to the doctor when I need to.
Medicaid matters to me because, especially with the CES waiver, I have autism, so the CES waiver in conjunction with me also being on Workers with Disabilities Medicaid, that enables me to work full-time in the community and utilizing the skills that I went to school for.
Medicaid matters to me because mental health services are needed as well as medical services for all people.
Medicaid matters to me because it covers a broad array of services in which my children benefit from, and that is dental, vision, and health.
Medicaid matters to me because it matters not only to 1.3 million clients in Arkansas, which is a large percentage of the 2.9 million population, but it also matters to the people who have jobs because there's Medicaid in hospitals and doctors and dentists and other facilities.
Medicaid matters to me because it is giving my daughter every opportunity to be independent and successful as she ages.
And Medicaid matters to me because for my family, it equals stability.
I prefer the independence of living in the community, and I like being able to earn my own living while being able to access the supports I need.
If we didn't have Medicaid, we could not afford to do the things for our kids that we're doing now.
It allows me to have caregivers to be my hands and feet because I have a mind that is fully functional, but my hands and feet don't work, so my caregivers are my hands and feet.
The moment my son was diagnosed with cerebral palsy at 6 months, I knew that I needed to find resources to help him thrive. And Medicaid has been that resource. From day one, we have pulled at Medicaid, and every step of the way, we have found resources that have met his need.
There it is. Let me thank you. Well, let me sit back. Thank you all for helping do that. Of course, we couldn't have made that video without everybody sharing their stories and speaking. And thanks also to Stephen Thornton in the corner who shot it and put it together. But before we talk about how we'd like to get this out, let me just, what are your takeaways? Do you think, are you happy with that video? Are there things you'd like to see, other directions?
I like the diversity, the variety of voices in there, knowing that everybody's coming from different perspectives of what they use Medicaid for, and so that I think appeals to everybody because, we have a variety of voices here, disability or aging or even just, our kids, different services like that. So it's nice to have that diversity. So hopefully when people see that video, it'll, remind them and appeal to them to do what they need to, renew or update their information. And also, maybe also, it'll tell people about services that, Medicaid services that maybe don't know about and say, well, I have a child or I have, someone that could use Medicaid services like that also.
No, I appreciate that, and I'm glad you said that. We think one of the real benefits of using this as a vehicle to connect with people is that diversity, the fact that you all have different backgrounds, you're from different parts of the state, and different people will connect with different members of the council who are profiled.
Any other reaction to the videos?
No, again, I just think it was great, and it captured everyone's unique circumstances and just the positive benefits of Medicaid. So it's really good.
That. Thank you. Any other thoughts? Well, I did want to talk a little bit about our plans for it. And so, as I mentioned, it's branded with the Renew Arkansas campaign, which is what we'll shift to once we get that notice that the PHE will end in 60 days. There, at about that time, or maybe a little bit after, we'll change from update to Renew. And what we'd like to do is put this video out with a news release announcing the launch of this campaign, really noting that it features you all, it features our Medicaid Client Voice Council, and try and get any coverage that we can media-wise, also through the DHS platforms that we have, such as the digital bulletin boards in our county offices, our social media accounts, really any channel that we can put it on to get folks' attention. But I also would like to enlist all of you all to help. We'd like to create individual news releases that really focus specifically on your involvement and give those to you all to distribute any way that you can. That might be reaching out to the radio station in your community that maybe you have a connection with that we don't. It might be posting it on Facebook. Any way that you have that you normally connect with folks, we want to give you the tools to send that out there and then hopefully spread that word even beyond where we'd be able to using our channels. So I also would like to get your thoughts on that. Is that something you'd be willing to do?
So we could take it where if you have a TV station or radio station in your area, we could contact them on your behalf. We could send them a clip of you, maybe even something we didn't use in the video, and we can give them your contact information, and then they may want to reach out and say, hey, we're going to do a story on this. Can we set up an interview with you? And so you guys would be our voice in your community, which is really, I think people would rather hear from you than DHS sometimes.
Hey,
so yes.
I have something to let DHS know. I just received a text from someone watching online, and they said they loved the video.
All right. Well, I love to hear that.
So we could reach out to the Jonesboro Sun or KAIT up in Bradley's neighborhood.
And also have a connection to KJNB, the new TV station in Jonesboro.
He may have somebody on the Cache City Council that he knows, and so which is him. And so, so anyway, we could enable you to be our spokespeople and serve us in that way, and that would be great.
And I think it was mentioned earlier in this meeting, one of the tough things is we don't have certainty on the end of the PHE. But perhaps when we meet again in 2 months, we will know more. So we'll plan to come back with those releases and have everything ready to go. And hopefully we'll be in a position where we can know a date when we're going to put this out. But we'll certainly give you an update then. So,
any other comments or ideas about messaging around that could involve all of you? No? Okay.
All right. Thank you.
Thanks, Gavin. All right, so we have reached the open forum part of the agenda. This is where our collective intellect here in the front of the room is ready to answer any and all questions that you have on any type of Medicaid or Medicaid-related topics. So if anybody has a question that's been on their minds, just raise your hand. I'll bring you the mic, and we'll have an open mic. Jerry's got one. Go ahead, Jerry.
We have a problem with food insecurity in Arkansas among low-income people, and I think the problem is getting worse because a lot of people have lost their SNAP benefits. We have one of the lowest levels of SNAP usage since in the last 2 or 3 years because so many people have gotten jobs or they've had minimum wage increases or they didn't respond to a request for renewal in a timely manner from the state. It creates a lot of problems, and I think one of the problems it causes is it affects people who are diabetic, and we have a diabetic pandemic as far as I'm concerned, you know, in my opinion. And if people are not eating healthy food, their condition is going to get worse. Whether you have heart disease or cholesterol or various other ailments, they're all affected by diabetes and can make your situation much worse. And so the more healthy food we can get to people, I think, in my opinion, I'm not a doctor, but in my opinion, food is the best medicine. You know, we can spend all the money we want on pharmaceuticals, but if you're not eating right, your health is not going to get better.
I don't think you'd get any disagreement from anyone on the panel. Did you have a question about that along those lines? Just a comment, okay. Any other comments or questions for, yes, Cassandra?
Okay, so this kind of goes back. I had sent some questions over to Jason a few months ago about just postpartum care, and I wanted to ask a question. I know that Governor Hutchinson mentioned at the press conference a few months ago on August 9th he talked about home visiting, and as far as the rollout for the home visiting program, I know that it was talking about providing services to some of the most intense cases, but how do they plan on going about identifying who would be a recipient for home visiting? Okay.
And we can definitely get some additional information out to folks. That program is part of our home program, but then also being able to extend that beyond just the Our Home participants. And so in terms of how physicians will identify individuals will be based on the coding that they use. Like when they go in, when a pregnant mom goes in to see the doctor, there's and we can get you the actual coding if you want, but basically within that, there's typical coding that a doctor would use when people think about medical conditions that make somebody high risk. Like it could be diabetes, as an example. It could be because they have high blood pressure related to their pregnancy. It could be because they have a history of infertility or any other number of reasons, right, that somebody would be considered high risk. But within that group of coding, there's a subcode that basically talks about because of social factors, right? Because of somebody who has what federally they're coming to call health-related service needs, or what we think about as like social determinants of health. And so that code is available then for the doctor to say, okay, you know, maybe there is one of those medical conditions that might make somebody be considered a high-risk pregnancy, but it also may be because of what's happening within their life, right? It may be because they're experiencing homelessness. It may be because of they have mental health issues, you know, whatever it is, right, that the doctor feels like might be putting that mom and that pregnancy at risk.
Okay. And then I just have one more question. We know about like the racial disparities with childbirth in Arkansas and the highest, Black mothers dying at a higher rate than other mothers. And thankfully, Governor Hutchinson's plan will address other conditions throughout the pregnancy, but is there any focus, at least does DHS have, on reducing the deaths of women after the baby is born, or putting any type of, extending postpartum coverage, or is there any highlight on that with DHS?
Right, so as you mentioned, so the first phase of that really is being able to offer those home visiting services and be able to offer that coverage for individuals who are in our home. But then as part of the governor's announcement, we are then extending that to other high-risk moms across Medicaid. So whether you're enrolled in the expansion program or any other Medicaid category, you would now be eligible for that if your physician determines that you meet the criteria for that. We are, continuing, much like many other options that are available, to look at postpartum coverage. That is an option that the federal Medicaid authorities have made available. Part of what we're looking at right now is to what extent that we don't have, to what extent those moms transition to other coverage or if they lose coverage. And from our data analysis, and we've looked at this for several years in a row now, by and large, most of the moms actually do transition to some other coverage within Medicaid, whether that's within the expansion program or, we also know whether it's within our kids or other programs. By and large, they do tend to transition to other Medicaid categories, but that is still something that's being explored.
So a large amount of participants are still getting Medicaid after the baby's born,
yes,
but just transitioning to a different category.
A different category.
Okay.
Right.
Any other questions from the council members for our panel? Okay. You guys are going to get some time back. Beat the storms home. Yes. Reminder, when we gather again the third Tuesday in January, we will be meeting in this building right outside, right to the north here. You won't have to go up any elevators. It's all one floor. It's a larger space. We're going to add council members. We have a committee that's reviewing all the applicants. We've got about 75 people who want to join this council, and so we're going to be reviewing those applications this month, or actually in December. We're looking to increase the diversity of the council. We're looking to maintain the geographic diversity, as well as add some programs that aren't represented, EIDT and some other programs, PACE, that aren't currently on our council. I'll just be honest, there's not a lot of men applying to be on the council, so we're going to try to add a man or two, but it's probably going to be mostly women that will join the council based on the applications we have. And we got to add some from from Jerry's neck of the woods. We don't have, you're the only one now, so we're going to change that, Jerry. We're going to add some more from Southeast Arkansas. So we appreciate you guys being here, as always, and we look forward to seeing you in January. In between now and then, I hope you have a happy and safe holiday season.